Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President and CEO of the DFW Hospital Council, and we want to thank all of you for being here today and welcome to this educational webinar that we're hosting in coordination with Forvis Mazars, who is an active member of the DFW Hospital Council in an associate member capacity. And we've worked with Forvis Mazars for many years and really appreciate them as valued friends to the council. Today's topic is strategic agility, planning, and execution. And this should be a great discussion about transformation that's occurred in healthcare over the past 5 years, new models you can use for strategic planning, and practices and processes that'll help you transition from strategic planning into really executing in the operational arena. We have a national expert from Forvis Mazars today, Chris Mazone, who is a principal in healthcare, and we're looking forward to his presentation. However, before we begin, please note this one administrative thing. We'll be more than happy to take your questions, but if you would please enter them into the question box, we'll try to answer them at the end of the presentation. Thanks for your cooperation. And with that, ladies and gentlemen, it's my pleasure to introduce Chris Mazone.
Steve, thank you very much. Appreciate the opportunity to be here with everyone today. Appreciate the chance to dive into a topic that I'm super passionate about. And I always appreciate the opportunity to share our perspective, what we're learning, and ultimately receive questions back from you all and be able to engage in some dialogue around it. We'll make sure we leave some time at the end for Q&A. Like Steve said, he'll be gathering those questions. So feel free to enter those in the chat. We'll make sure we get them answered. Like Steve said, our goal today is really to dive deep into this idea around kind of what's happened in the last 5 years, how are organizations thinking about strategic planning differently today than maybe they have in the past. And so as we're going through the conversation, we're going to share some survey results that we've had from a national survey we do where we pull about 120 different healthcare organizations, feedback from them, priorities, what's keeping them up at night. We'll share those results with you. We also want to make sure we're spending time talking about the agility that we believe organizations are going to need to have and how they're going to have to adapt a little differently than they did in the past as they think about strategic planning and how they move forward with that, and then just share some best practices that we've learned along the way. So let's dive in. Last 5 years, we are big believers that all of us have really experienced an entire lifetime of events in the last 5 years. You rewind back to 2019 and this idea of volume and value exploration, it was becoming really important. It was a lot of the conversation, a big part of the conversation. And then you move into the pandemic and the public health emergency in 2020. And that really put strategic planning on pause for most organizations. A lot of organizations hit pause on that. They were focused on the operational and financial stresses they had that led into 2021, into 2022, where there was still a performance crisis. There were organizations that came through the pandemic and financially were really strong, but there were a lot of organizations that came through the pandemic and had truly a crisis happening from a financial and a performance standpoint, that it really wasn't until 2023 that a lot of our clients or a lot of organizations we've met with said they really started steadying the ship. And now what we're learning and what we're hearing is that there's this kind of return to a new normal that people are having, especially as it relates to strategic planning. But you think about the themes, like what's keeping you up at night, what's driving your priorities, how are you thinking about it? And that's why we do this survey. We do it on an annual basis. And like I said, it's about 120 different healthcare executives across the U.S. And if anyone wants a copy of Mindsets, you got my contact info. I'd be happy to get it to you, the full study. I'm going to share some of the themes with you. But some things really really came out of that for us. And it was telling. It helped drive how we think about strategic planning and how organizations are thinking about what's most important to them. Financial sustainability, workforce, value-based care, strategic planning. Those 4 themes were the themes that resonated out of that analysis. And so I'm going to share just a little bit about each. Financial sustainability. So margins are tight, but the outlook is encouraging. That was the message we were hearing. 60%, though, you think of the 120 different individuals that responded, 60% believe financial performance will improve in the next 2 years. 50% ranked margin improvement pressures as one of their top 3 concerns over the next 3 to 5 years. So the statistic in here that really blew my mind was that 66% considered rev cycle as a top concern, but only 5% claim that their rev cycle is very strong. So a lot of acknowledgement around the need to focus on it, the importance of it, and yet only 5% felt like their organization had a strong rev cycle. That's telling for us. That's telling for us on how we think about strategic planning and how organizations are thinking about their priorities as they move forward. Workforce is something y'all have been hearing a lot about now since the pandemic, but the shortages, the challenges that are going to continue to persist, it's not going away. You look at that number 1, clinical staffing shortages ranked as the top concern over the next 3 to 5 years. It was the number 1 concern, clinical staff shortages. 45% say that there's going to be challenges around productivity, burnout, turnover, and that's their top concern. So you still had a lot of organizations recognizing that workforce as a whole is going to be a major priority for their organization moving forward. 60% rank decreases in productivity as a top challenge to achieving financial sustainability. So we started to see these tie. Workforce, financial sustainability, the themes started to connect. 68% ranked change fatigue within their organization as one of the top concerns. So you think of that, you've got all of this happening, and you've got change fatigue happening at the same time. And so organizations know value-based care is important. That was one of the other themes, but there's so much change, so much that's happened in the last 5 years that there's burnout, there's shortages, there's all these different conflicting priorities. And so while value-based care is clearly important and there's some urgency and there's some action planning, the ROI on it still remains uncertain. Most of the clients that we're working with, the strategic plans that we're walking organizations through right now, this is still a topic that they're wrestling with. It's still a topic that is creating a lot of energy in the room. Whether that's a strategic plan I'm doing right now with a $6 billion organization, or it's a strategic plan I'm doing with a single rural community critical access hospital. This continues to be a topic that organizations are wrestling with and trying to think through and process. The 4th theme that emerged is really where we're going to spend our time today, and it was around strategic planning, that organizations believe they need to move forward and strategic plan differently. 53% of healthcare organizations said that they paused their strategic initiatives during the pandemic. That created all kinds of challenges moving forward. As you think about prioritization, partnerships, we started seeing shifts in how organizations were thinking about all of that through the last 5 years, and now today, how they think about moving forward. 65% say that their operating model no longer aligns to the needs of their strategic vision. 65% feel like they don't have the optimal operating model that aligns to where their vision is, to where they're trying to go. That's a problem. So as we think about strategic planning, as we think about the traditional 5-year strategic plan, it's no longer what we're hearing. It's not what organizations are desiring. It's not how they're needing to move forward. They need that agility. They need to be able to adapt quickly inside of what they're doing and begin to plan for the future. And so I'll get into a little bit more about how that's impacting organizations and what we're seeing and what we're recommending in today's environment. But 49% said that they plan to revisit their enterprise strategic plan this year. And so when we did this survey, you've got all these organizations that say they paused it. Only half were going to start this year. That's still a big number. That's still a lot of health systems starting a strategic planning process at a similar time. And so we know there's a need for it. We know that organizations are thinking about strategic planning differently. And yet we know that there's competing priorities. That number of 48% of respondents said that they spend less than 10 hours a month on strategic planning. Strategic planning being the big rocks, the important things. And yet the executives that were filling this out said that around half of them spend less than 10 hours a month. The other numbers were like 15 hours. So it wasn't that there was a wide range. It's really a recognition that they were not spending enough time on their strategic top priorities where they feel like they need to be spending their time. 75% of healthcare organizations now develop or update their enterprise strategic plans every 1 to 3 years. I'll lean towards the 3. 1, it's probably more of an operational plan. But what we're seeing is organizations are really starting to do an enterprise strategic plan every 3 years with a vision that's focused on 10 years out. And so it just looks different. It's no longer a 5-year, do a strategic plan every 5 years. We're hearing from all of our clients and through this survey that that's too long. The pace of change is too quick, and we've got to adapt differently. 35% said that they achieved less than half of their strategic plans in their last cycle. So a lot of work to do. All of that really helps us drive our thought process on strategic planning. So the survey is a part of that. The engagement with our clients and diving into is a part of it. And ultimately, we know that balancing competing priorities is key. And so you think about what your organization focuses on every day, and they're all priorities. There's none of these on here are not a priority. Your community is a priority. Your providers, the health system, your patients, the regulatory side, your employers, suppliers, vendors, employees, right? You've got all these competing priorities on every single day that as executives, you all are dealing with. And what happens is we believe truly the tyranny of the urgent takes over. And so the things that are urgent is where people are spending their time, and they're not really focusing on the important things because of all of these competing priorities that are out there. We know that multiple market forces are happening too. You got all kinds of things happening. You got health equity. You've got the need to focus on innovation and AI learning and financial performance. And we talked about workforce and value-based care. And you've got an ambulatory and an outpatient shift that continues. You've got population demographic changes. I'm kind of jumping all over in here. But all of these are rapidly changing. And as a team and as a strategic plan, going through a strategic plan, you've got to take all these into account in order to really land on where your priorities are. In the midst of all that, we know that there's PE, mega mergers, non-traditional providers happening in markets all over the country at probably a more rapid pace than ever before. You could argue it in the numbers, but it's more in the size of the transactions. You got larger transactions happening, larger partnerships coming together with some drivers around how they're thinking about that. You know, you look at 22 to 23, and it was an active year for M&A. And we were a part of several different mergers, several different acquisitions, going through that process and thinking about the size and scale. They were just bigger. The last transaction that I was a part of was a $5 billion organization coming together with a $2 billion organization, and that looks very different than what we've seen in the past from some of these transactions. We also know that there's all kinds of drivers, consolidations happening all around us, and we know that 20 transactions were announced just in Q1 of 24. So they're happening. They're happening all around us in a variety of different ways. All right. The next thing in here is around prioritization of resources. So inside of strategic planning, as we work with hospitals and health systems all around the country, prioritization comes up over and over again. And we know that organizations have to prioritize. There's so many competing priorities. You just saw it. And so one of the things we like to walk our clients through is this idea around impact and urgency. And it's, what are you planning for? Plan, maybe you're going to act on it later. You're going to evaluate. You're going to wait on that. What do you need to kind of just monitor? And then where do you really need to act now? And so what we like to do is begin to create this little four blocker in the context of impact and urgency. And the idea here is, if it's really urgent, but it's really low impact, then you really need to act now. And so whether it's growth strategies, value strategies, market strategies, workforce strategies, they're all competing. And so this is a real example from a client, obviously a lot scrubbed and some details scrubbed, but it helped prioritize where they were going to focus as an organization and how they were going to move forward. And so our perspective on strategic planning, a lot of words here. I'm not going to read all this to you, but the strategic plan has to be executable, financially viable. It has to be sustainable and measurable, and it has to be impactful to the organization. All of these are critical components of the process. It also has to align back to the organization's mission and vision, and that's the primary thing that coming out of the last 5 years, organizations are saying we need to relook at our vision statement. Some mission, not as much. We see a lot more inside of mergers when organizations are coming together and need to create a net new mission. But in the vision, it's starting to change. So again, a lot here. Our process follows a very consistent framework on how we do it, but we personalize every single process to the organization. And we would encourage all of you, no matter who if you're doing it internally or you're bringing in an external partner, we would just encourage you that you don't have to just follow an exact process. You gotta follow the process that fits your organization and what you need based on the objectives and the vision of what you're trying to get to. And so listening to the needs and challenges of every organization is critical. Having a deep understanding of your market drivers, that your own clinical capabilities, really looking in the mirror and saying, what are we great at? What are we okay at? And what do we really need to improve on? The community needs is another huge piece of this. One thing that we've started doing inside of most of our strategic plans, not all, but most, especially where it's required, if you're a nonprofit organization, is aligning your community health needs assessment, your CHNA. And so we're timing it so that 3-year cycle of mandatory, the regulatory side of CHNAs every 3 years, we're trying to align that to the strategic plan so that the community health needs assessment is conducted at the front end of the strategic plan. So outputs of that can be leveraged into the priorities within the strategic plan itself. And so that's probably a newer thing that we've seen. Obviously, CHNAs have been around for, I think, 12 years. We're on our 4th cycle going through them now. But it's something we're starting to see a lot more momentum and alignment around. Existing partnerships, a huge driver, and it's something that we're going to continue to see as a driver for organizations moving forward. We know that the strategy and the alignment to mission and vision is critical. And we know that engagement of different teams inside of that alignment is critically important to your organization's ability to execute what your priorities are. That the stakeholders inside your organization need to understand the why. They need to understand the alignment to your priorities, to your key strategic objectives, whatever those might be, back to the mission of the organization, the why you exist. And the vision, the aspirational, where are we going? Where are we going to? Where do we want to be in 10 years? Where do we want to be in the future? And so how you engage stakeholders in that process, we believe is really important, whether that's board engagement, whether that's your providers in your market, whether that's your executives or whether that's your department leads, that engaging stakeholders through the process is critically important to the organization's ability to execute in an efficient way and for the organization to really embrace what those priorities are and feel a sense of ownership of them. the other important part we'll talk about here is that at the beginning of any strategic plan, as you're going through it, we would just encourage you to ask some key questions right at the start of the strategic plan. And again, these aren't the exact 5, and they're not the only 5, but they're 5 questions to consider asking before you start your strategic planning process. And it's, what do you want to achieve in the next strategic plan? What are you hoping to achieve? And to be able to get your small group, whatever your executive leadership team is, to sit down in a room and really answer these questions before you design your process, before you move forward into strategic planning. Is the focus of your strategic plan primarily on aspirational and visionary components, or is it more operational focused? And just being honest with yourself. What do you need in this cycle? What do you need now? Aspirational, is it bold strategic direction and initiatives that are going to drive your organization into the future? Or is it more focused on optimizing and creating greater efficiencies within your business units? And it might be a combination of both, but that transparent conversation at the front end, creating clear expectations of what the outputs are going to be, becomes really important into creating the right process for any organization. What do you like about your last planning process? Where did it fall short? I.e., was it ambitious enough? Did you hit enough innovative things? Did you engage the right stakeholders? What would you want to change? What should stay the same? All of these are really good questions. What level of engagement throughout the organization do you want to have? We see this as a competing topic for a lot of organizations we work with. It's the idea that we want everyone engaged, but we don't have time to do it. We want everyone engaged, but we're sensitive to the amount of time that they're going to have to spend on it because we're thin in the team and how we can go operate. And so they sometimes become competing priorities in there. And so really thinking about the level of engagement, how to engage them in unique ways. There's innovative ways to engage your team, to engage your entire organization inside a strategic plan without having to pull them out a day a week into planning sessions. And so being able to think through that at the front end and get clear really helps optimize your strategic plan itself. And then how are you going to define success? Because oftentimes one individual inside the executive leadership team will answer this one way and someone else might answer it another. And we're going through one right now, and you're sitting down with the executive leadership team members one-on-one, and they're answering this differently. And so asking this question with them together in a room, bringing them together and saying, all right, let's talk about how you're going to define success of this process, creates clarity in what you're trying to achieve, and it creates alignment right away on what you're trying to achieve. And there's all kinds of initiatives that you're going to want to tackle. And so prioritizing those becomes important. Here's a handful. And so you've got key priorities, initiatives that you want your strategic plan to tackle. And maybe it's all of them. Maybe it's growth and access. Maybe it's quality and engagement. Maybe it's revenue integrity. Maybe it is financial sustainability or being data driven. You want to really focus on that side of it, or it's the VBC space or the provider enterprise. You can see a lot on here. Partnerships. Partnerships continues to be a really hot topic for us in the last, I'd say, 2 to 3 years of strategic planning, especially in the last 2 years. It's a number one thing that's coming out. People are thinking differently about their partners in the future. And it's not just mergers. It's not just member substitution or acquisitions. It's really evaluating partnerships differently and beginning to think about the art of the possible with partners and what are things you could do differently today than you ever could in the past, and who do you want your partners to be and why, and getting clear on what are your guardrails to those partnerships and how do you want to think about the ideal partnership. When should you engage in discussions with different partners? So those conversations are happening much more frequent pace and a much more emphasis than what we've ever seen in the past. And so you got all of these components. You got strategic priorities. You're figuring out your stakeholders. But at the end of the day, we believe, and again, this is our take on what a strategic plan should look like, that it starts with your mission. It's at the top. It's your true north. It should drive your vision. And your vision should be aspirational. And it should drive your values. Or what we're beginning to really rally around is that organizational values are no longer used very well. from our perspective. They're used at times, and maybe some of you would disagree with that. But what we believe is guiding principles are actually values in action. And so if you have guiding principles that can really drive your behaviors, then those words in there, you can bold the right words and you can tie those into your values. But organizations tend to embrace that and get more out of it, and they can really use it to drive the culture and the behaviors that they want inside their organization. And then whatever you want to call them, I've heard all the names, BHAGs, pillars, whatever they are, we call them key strategic objectives, your KSOs, and your success measures to those have to be established. And those are things like team, value, whatever those might be. You're going to have these key strategic objectives. And then underneath that, you're going to have a prioritized set of game changers, strategies, whatever you want to call them. With us, if we use game changers, it's more in the context that not all game changers are going to be known across the entire organization, but you've got to be able to communicate your strategic priorities underneath your key strategic objectives so that there's clarity on where you're going as an organization. These are the things we're focused on, and here's how we're going to do it. And then underneath that, we know that there's strategic tactics, and you're cascading that across the organization, and all of that has to align. That there's a lot of those, and that's part of the execution plan or the playbook or whatever term you want to use. And ultimately, has to align. All of that has to align ultimately into achieving your why, your mission, and the vision of where you're going. And so here's just a quick example process that we use to ultimately outline the strategic plan itself and the steps into it. Again, I said it at the beginning, there's not a one-size-fits-all, and this is not our only way that we're going to do strategic planning, but thought it might be helpful to just talk through each of these components with you and kind of how we think about it. And it's a simplified version of how we would think about executing inside of a strategic plan today. And so you've got this need to engage right away from project planning, all that we talked about around sitting around a table and making sure we have the right process, we've got the right stakeholders we're going to engage at the right time. There's expectations on roles and responsibilities, and you're immediately right away starting with mission. And you're saying, are we confirming it, or do we need to design it if it's a new organization coming together? But you're starting with mission right away, and you're outlining the process on how you want to design or confirm the mission, the vision, the values, the guiding principles of the organization. And so all of that is that first kind of stage, if you will, of the process. You move from there into discovery, and now you're really diving into the market. Everything from service line data, inpatient, outpatient, industry assessment, competitive analysis, all that happens inside of that is the foundation that's going to help drive the priorities. And there's stakeholder engagement that's happening. That stakeholder engagement, again, is one of the questions hopefully you're asking before you even launch this, but you're engaging the organization. We use a couple of different methods in this. We've got some surveys we do. We've got some interviews we'll do. We like to go out and engage employers, board members in different ways. We also have a full organization-wide survey that we do. It's called Clarity, and it's meant to help us drive prioritization of where the biggest needs are going to be inside the organization as it relates to change readiness, as it relates to burnout, potential turnover, optimism, where's the area of growth and kind of camaraderie, all that's happening. So that survey is something we can do organization-wide. But for a lot of organizations, they don't really need to do that, or they're not ready to do that. It's not the right time to do that. And so there's a lot of ways that you can engage your organization, but it's critical that you do so. That way, when you're rolling out the strategic plan at the end, they were a part of it at the beginning. And it's not something that's just being told to them what to do, but they're really a part of creating it and being a part of the prioritization. Taking a real clear financial snapshot is important. And for us, that doesn't matter if you're a critical access hospital or you're a $10 billion health system. If you're a $10 billion health system, then you really should be looking at your total capital and how you want to spend it. And if you spend it here, if you're going to build a new tower for $300 million, or you're going to build a new hospital for $600 million, is that the right way to spend that money? And does that dilute your ability to go out and acquire somebody else? Or if you're looking at the capital that you have from a staffing standpoint or provider recruitment or whatever that might be, a new ambulatory clinic that you want to add, having a real clear understanding of the financial snapshot and what money you have to spend in the next 3 to 5 years, 1 to 3 years, is really important right at the baseline. And then looking at what's our projected financial performance based on where we're at today and under what scenarios, what levers do we need to pull in order to improve that. Current state operational understanding is another piece that we're hearing over and over again. And you heard me talk about it. You heard me talk about the operating model inside the survey that we conducted, that organizations do not feel like they have the right operating model in order to execute against their strategic vision. And so we like to tackle that early on in this process so that we can begin aligning whatever those priorities are. Do we need to shift the operating model? And if so, how? And in what ways? What needs to change? And then ultimately, you start that process of looking ahead, looking to the future inside of discovery, some ideation around the art of the possible. What could you be doing? From there, we like to shift into visioning. And we do this a lot of different ways. We're big proponents of bringing stakeholders together in a room and being able just to think about wildly successful. Really simple acronym we'll use, IWWS, BOWI, WWTLL. If we were successful beyond our wildest imagination, what would that look like? I know y'all are going to use that now. But that idea of what does wildly successful look like is a really important question for organizations to ask. And we like to do that in workshops. We like to do it in what we'll call blue sky visioning sessions. But ultimately, what we're trying to do is bring leaders together to think about the art of the possible, think about what they could do, to think about the vision of where they want to be. And then that helps us prioritize. And so as you start thinking about strategic priorities and kind of what are those opportunities and what's the framework for that? How are we going to develop it? That all can happen during that time frame. And then you transition into the develop phase. And so as you go through discovery and visioning, you really start creating work streams, if you will, around the priorities. And we recommend that for a lot of reasons. 1, stakeholder engagement. 2, accountability on the ownership of the execution. And 3, not everyone has to be involved in all the details, the tactics on how you're going to get it done or how we're going to measure every little piece of it, but it has to roll up. And so we like to do it in the form of work streams so we can create the right priorities, measure the success, pull it back into how you're looking at key strategic objectives, and make sure we've got the right success measures aligned to that. The financial and capital plan is a critical piece as well. I've talked about that a lot. That's often the time where we start to do it into the strategic plan itself, is once we have the priorities. So if these are our priorities, how does that tie to our capital and our financial plan, and make sure that there's alignment within there, along with incentive plans and other things that could come into that discussion. And then we like to bring it back to an executive leadership workshop and validate, do we have the right priorities? And then what's the sequencing around this? If we do this, do we need to sunset anything else? And so a lot of organizations are great at adding new things. They're not great at sunsetting old things, or thinking about service line rationalization, or thinking about the need for integration. So we like to really step back and ask some of these hard questions at this stage to say, if this is our plan, what do we need to continue doing? What do we need to stop doing? And then ultimately, that strategic plan starts getting built out into that execution playbook fully. And we say deliver. It's an active process of how we're going to measure success, how we're going to have an accountability plan, how we're going to do report outs, how we're going to continue to engage other stakeholders into it, how we're going to communicate to the organization the priorities, the mission, the vision, the guiding principles, the key strategic objectives, and the things we're focusing on. We always like to tie that back and engage the board again inside of that. And then you come down into stage 6, and it's really around execution and monitoring. One of the things that's happened with several of our clients is they've recognized the need that they want to do a strategic plan every 3 years. But 18 months in, they ask us to come back and facilitate a workshop around, are they executing and doing doing a monitoring process around how are we doing against our measures of success. Has anything pivoted that we need to change now and not wait another 18 months before we change our priorities and how we're communicating our strategies? And so some do it in annual checkpoints, some are doing it in 18 months. It just depends on the organization. And underneath all of that, you've got your governance, you've got communications happening across the organization, you've got change management that needs to happen as you navigate it, and you've got really strong project management to ensure that individuals know where you're at in the process, where we're going, and can help navigate that for an organization. So there's a whole lot there. I just walked you through, and again, it's one example. We've done strategic plans with 5 or 6 different processes, but they all tie back to something pretty similar to this, that these are the core steps that organizations are taking right now as they move forward in strategic planning. And so we know that in order to do this, you've got to have agility. And so what's agility look like for an organization? We mean you've got to have an agile process. We can't put a process out there and say, this is exactly what we're doing, and then hit a landmine and then just not be willing to adjust. And so you've got to have a process that allows you to adjust based on what you're learning and what you're finding throughout. It's got to be informed by market, competitor, community needs. It can't just be isolated inside the organization. You've got to look outside as well. We also believe it's got to be financially enabled and growth focused. Those are 2 components of strategic planning that organizations, for the most part now, are all embracing and fully behind. It's a growth-focused strategic plan. Like I said at the beginning, there's a time and place where it's got to be more operational efficiency, and that's part of it, but there's still elements of growth inside of there. And it's got to be deeply cascaded, that organizations, when they do strategic planning and hold it close to a small group, tend to be less successful at executing their strategic plans. And so in order to have it intentionally executed, it has to be cascaded across the organization. Results driven, and it's got to be measurable. We've seen too many strategic plans where they'll go through the whole process. They'll come up with these amazing priorities, and then you read them, and I'll ask the question around, okay, so when you achieve that vision, how are you going to measure success? How do you know you achieved the vision? And it's not really measurable. And so having it be measurable is really important to that process. And then having proactive adaptability throughout the process is important. And by that, I can hit on a lot of things. I continue to sit and hit on engagement of stakeholders. We've had strategic plans where we had a set of engaged stakeholders we were going to engage in the vision, and we kept learning that there were others that people would say, well, have you talked with so-and-so? Have you talked with this organization? They're doing this. And so we've been able to adapt, and we've tried to build a process that allows us to go back and say, okay, we need more input. And so we're going to adjust, we're going to go back. Or midway through the process, we recognize that there is a partnership that's worth pursuing. And if that partnership happens, it would change our strategic priorities. And so let's engage in that and be ready to hit pause in areas where we need to hit pause. And that's okay, because we need to go figure out if this is going to be our path forward. And so that adaptability becomes really important. And then ultimately incentive aligned. Inside your executive team, I'm sure there's an incentive component to their compensation. Oftentimes there is. And so the strategic plan needs to be aligned to that, so that the organization, the leaders, are focused on the things that are going to help you achieve your vision. It's no different than with providers and provider comp modeling and how we're seeing that play out today as well. And so I really, wanted to say thanks for letting me walk through this process. I know the ask was to leave about 20 minutes at the end here for some Q&A. And so I'll pause now and answer any questions, Steve, that maybe have been coming in.
Yeah, thanks so much, Chris. Great job. Wonderful presentation. To the people that are participating, if you have questions, please put them in the question box, and we'll be more than happy to have Chris discuss those. And while you're gathering your thoughts and before you put those in, Chris, let me ask you this. Of the strategic plans that you're currently seeing, are more aspirational or operationally focused?
Yeah, great question, Steve. I would say it really is a mix. That I'd say 2 years ago, more operationally focused. Today, more aspirational focused. The organizations are, in the last, I'll say this past year, the focus is now on aspiration. It's around longer term visioning. It's around identifying and having the right partners. It's around organizational alignment to priorities and towards game changers and thinking differently. And that really has been a shift that we're seeing. Obviously, 3 years ago, if organizations were engaging inside of strategic plans in 21 and 22, it was more operational. It was more around workforce and some shortages, but now we're starting to see that shift happen.
Right. While you were talking in the chat box, somebody asked, is this PowerPoint available and/or recording available? I know for a fact the recording's available, and Chris, I know our Chris will work with you on if this PowerPoint can be made available to people that registered.
Yep, great. Happy to work with Chris, and Chris, feel free to share my contact info with anyone that would like it.
And Chris, the other thing, as you well know, especially in healthcare, we continue to have to address workforce challenges. During the pandemic, we definitely had workforce challenges. One of the things we strive to do is work with our nursing schools. We try to work with, people with the generational gap. How have you been seeing operations and organizations innovate to address workforce challenges?
Yeah, that question we could spend another hour on, right? There's so many things happening in that space right now, and part of that is it depends on which part of the workforce you're talking about. The clinical workforce is creating a need for innovation in a different way, whether that is the expansion of telehealth, and all of us know the expansion of that in the last several years and what that means, or whether that's in the use of physician extenders, nurse practitioners, whatever that might be, and how they're leveraging their teams to do more and to expand the types of services that they're providing. We're also seeing it in forms of one of the accelerators for partnerships and for mergers, that inside of a merger, there's an ability to create efficiencies within executive leadership, and the shortage of executive leaders in the market is something that we hear about. And so that's one thing that we are seeing organizations do to address that. I could go on. There's a whole lot. A lot of it too. I'll go back to one other bullet around the idea of retention, that stay interviews and focusing on your current workforce, especially your high performers, and focusing on retention is beginning to carry a lot more weight than maybe it even used to in the past, where there's a recognition that you can't afford to turn over your leaders as frequently, and there's a need for retaining that top talent. I think that's always been the case, but we're just hearing about it more and more and different strategies around how to do that.
Right. A couple of questions have come in since you were talking, and this one's pretty tough, but I'll go ahead. When working on and addressing challenges that a hospital or health system is dealing with, how do you handle clients that just don't seem to buy into the new strategies or new ideas?
That is a good one. Because the question of how do we handle it, or how are we seeing CEOs handle it?
Well,
Pretty
I think it's probably more how you handle it, but I think it's also what's the perspective from how the CEO handles it also.
Yeah. Yeah. I mean, gaining buy-in across an organization is really difficult. And there's a lot of books out there and content you could read about how to do that. And we use all of it, 5 dysfunctions of a team and leading change and good to great and all the different books that touch on that they talk about it. But creating alignment around a vision, a mission and a vision is one thing. Creating alignment around your key priorities and your strategic objectives is really another. And so not everyone's going to, inside an organization, is going to get to have all of the words they want inside a mission and a vision. And so at some point, people have to decide, are they on the bus or are they not? Do they believe in this mission and this vision, and are they aligned to it? And can they come under it and be a part of helping achieve it or not? And if not, I have myself encouraged people to go look for somewhere else to be. Because I think if you can't get behind a mission and a vision of an organization, maybe it's not the right organization for you. And maybe that sounds harsh, but I've had some of those candid conversations just in the last year. As it gets to the key strategic objectives, I think it's important to create the right atmosphere, the right platform for everyone's voice to be heard, for everyone to be able to have a chance to share why they think these are their priorities. And at the end of the day, you're probably not going to get everybody fully aligned on those priorities, but you can get everyone aligned on these priorities that we have are going to help us achieve our mission and vision. And so I think the importance of pointing things back to alignment around mission and vision, and the priorities are a part of achieving that mission and vision. It helps mitigate that a little bit. It's not going to solve it. You're going to have individuals inside an organization that just can't embrace it and don't. And then you're going to have some that are just underperformers, that they see it, they're not inspired by it, they start acting out, they start not being as engaged. And so it sounds pretty harsh when I say these things, but I truly mean them. I think you reward mediocre performance with a generous severance package, and you help them find somewhere else where they can go use their talents and go perform. Because if it's not in alignment with the mission and vision, and they can't get behind really helping you achieve that and move forward, then they're probably not in the right role, and it's probably not right for them or for you.
That's a good point. And kind of a follow-up to that question, Chris, do you have suggestions on how to get better physician buy-in? For example, I want to get my providers interested in infusion therapy. So this one's pretty specific, but I guess, if they would allow me to rephrase it, you've got many different people involved in strategic plans, as you mentioned, and physicians are certainly an integral part of it. Do you have suggestions on how to get better physician buy-in?
Yeah, engage early. That's my number one lesson learned with physician and provider alignment is engage early and be open to hearing and listening to their whys, hearing and listening to what they're trying to achieve. Engage in that, be open-minded in it. And then whatever your response is, whether it's alignment and you're going to move forward with them, or whether it's something they don't want and you do want, or vice versa, leverage data, tell the story and tell it around the why. Why do we need this service? What's the impact to our mission inside of this service? How does it relate back? Why do we need it? What does it do for our communities? Does it help us point people towards healthier communities? Does it help in a specific way? So I always say, tie it back to the why. Don't come out the gates right away with a preconceived, this is the only way to do it. Be open and listen, and then really come back with data and be able to have a conversation and ask for their time. Say, can I just walk you through our why? And then I always love to ask physicians the question of, just show me where I'm wrong. tell me where I'm wrong, and then let's talk about it. Because I've found that to be a great way to diffuse some of the immediate reaction, but also creates an opportunity to have really good, candid dialogue with providers who ultimately, hopefully, are aligned to the mission and what you're trying to achieve overall together.
Good point. Hey, another question that's come in, Chris. How will the proposed updates to the HRS ruling impact, in your opinion, transactions?
Another one we could spend a whole lot of time on. I had the privilege of being a part of the Freighter ThedaCare merger last year and leading the organizations through that. And so that process and what happened and what needed to happen with filing looked very different than what I'm doing right now with an organization in Ohio. And so what it's going to do is it's going to put more of the onus, more of the work back on the hospitals, the health systems to do the due diligence and answer the questions. And so it's going to create a little bit more work back into the organizations and away from what FTC or what else is being done kind of post definitive agreement. And so that's probably the biggest change I see. Obviously, more regulation, more kind of scrutiny around transactions is what we would think. But I mean, it's been a long time since we've seen major change inside of that. And so I think it's a little bit still to come. But the one area we know that's going to happen is more of that's going to get put back on the organizations to do their due diligence and do the work ahead of time.
Right. Chris, we got a little follow-up to a previous question, and
Sure.
I know you've kind of touched on this, but I'll go ahead and read it. It goes back to getting physician buy-in, and it says,
Sure.
what if you've worked hard and had the data and you present data to the physicians and they push back and say, that's just not the standard of care? I don't know if you've ever run into that.
Only a dozen times or so. Yeah, great question. And I'll be the first to say I am definitely not the one with all the answers. And it's not a one size fits all. And so these things are really complicated. And I think just being honest with ourselves and saying that is important. Because they all are different. I mean, having the right data and being able to validate that data, really important. And you're going to get providers that are going to say, that's not the right care, that's not the best care. And one of the things that we like to do is bring it back to best practices and engage them with other organizations that are doing it and have seen good results. And so peer-to-peer discussions inside of there has always been my number one answer. I'll work out to some of the different clients that we have, some of the friends that we've got in other organizations in non-competing markets that would be happy to get on a phone call with a physician and talk to them about why they're doing what they're doing. And I'll tee it up that way. I'll say, we're not looking to solve anything today. I just want to know if you two would both be open to sharing your philosophies or your why behind this, and then just hearing each other out on what works and doesn't work, and just having an open dialogue. Most of the time, we can create those engagement opportunities. Every once in a while, there's people that push back and won't, but for the most part, that peer-to-peer, engage them in the right context with the right setting tends to help a little bit.
That makes good sense, Chris. I think we've got time for one more question, so I'm going to ask the last question. And I'm an old guy, Chris. You're young.
Yeah.
But what about the timing and cadence related to strategic planning? How has that changed over the years?
Yeah, you're right. And I hit on it a little bit, Steve, but I'll emphasize our take on it. It used to be 5-year strategic planning was the norm. And our take is that's too long. The healthcare environment is changing so rapidly right now that having a set of priorities that's 5 years out and not reassessing those for your organization feels too long to us. Now, it's situational. Maybe times that is the right thing. But so having a 3-year strategic plan Yet the vision statement and re-looking at your vision statement, and that's more of a aspirational, longer term, 10-year type of a look, is an important part. The other thing I'll say in there is because you're doing strategic planning every 3 years, that doesn't mean your key strategic objectives or your game changers or your strategic priorities can't be some that are more long-term. You can have them in there. It's just in 3 years when you're redoing your strategic plan, you should reevaluate, should this still be there? Is it now a short-term? It was a long-term, now it's a short-term. And so what we're seeing is a lot of consensus around that inside the industry, that 3 years is becoming more of the new norm because of the rapid changing pace in the environment that everyone's in. And then that cadence of a check-in, whatever that is, of coming back and really challenging your strategic plan. And I know most organizations do this well, and they're checking it against their measures each year. But being able to step back and really challenge, do we have the right priorities, becomes a really important step in that process. So appreciate you asking that question. I think it's something that we've seen a big shift in the last couple of years, and I would expect it to continue.
Chris, you've done an excellent job. What an excellent presentation. Great questions. I thought I would turn it back to you if you have any closing thoughts, and then we can conclude the webinar.
No, just appreciate the opportunity. What you all are doing is really fantastic. Appreciate the organization. Appreciate the chance to come share with you. And yeah, so just thank you. Enjoy the rest of your weeks.
Thanks, Chris. And you have a great weekend. And we'll see if Clemson and Virginia Tech have a good game this weekend.
Yeah, exactly. Thank you. You enjoy it as well.
Thanks, Chris. Bye-bye.